Hi, I'm Stephen Michael Casada. This state is a kaleidoscope of cultures and a land of breathtaking beauty. But too many are suffering from behavioral health issues such as substance abuse, addiction, and mental illness. And unfortunately, at this critical time, we have witnessed a breakdown of our behavioral health system. It has affected services and triggered fear and anguish among many of our most vulnerable families.
I think what's happened in behavioral health in New Mexico, instead of taking a step up, I think it's taken a step down and a step backwards.
Over the course of time, since 1998, services are fewer and the network is weaker. And it's probably weakest now than it's been since 1998.
I think we've put many of our good providers out of business. These are New Mexico businesses. When we brought in Arizona people.
Keep in mind that they were brought in because supposedly an audit had projected $36 million in alleged fraudulent payments. So the state turned around and spent $24 million to bring in the Arizona firms. And then that doesn't include the $3 million that they'd spent to pay PCG for its questionable audit. All of that came out of the state's general budget. That's $27 million that we've spent to put New Mexico behavioral health providers out of business for fraud that hasn't even been proven.
There was no time that the agencies were allowed to see what they were accused of, face their accusers, defend themselves, and, save their reputations.
I think we haven't moved forward at all. I think we've done a thing of trying to prove fraud and criminal activity, and I don't think it's been proved.
And the thing that makes me absolutely crazy is that the jails in the state have been the biggest providers of mental health services.
When the behavioral health providers were shut down in Rio Arriba County, there was a tremendous amount of disruption.
Community mental health centers have served as safety nets for thousands of New Mexicans for many years. Cultural competency and trust are crucial factors in the service delivery, especially in rural areas. The shutdown of provider agencies that have served these areas for generations and their replacements with firms from another state and a different culture have had a profound effect on many New Mexico communities.
The state didn't have a very good transition plan in place. Had a provider gone out of business, the provider itself would have had to develop a transition plan to assure that every single person was cared for properly and services continued. The state uprooted 15 providers and didn't have a transition plan.
A lot of the professionals left. They quit. They're fearful of what New Mexico is doing with behavioral health. They're afraid of their licenses.
There needs to be some accountability on, what is the impact on clinical service.
There's plenty of anecdotal evidence that points again and again to shootings and to suicides and to things that have been elevated since this takeover occurred.
There have been over 30 police shootings in New Mexico in the recent past, and many of the victims who were acting out were mentally ill. And so those families who've been struggling with the reality of mental illness are sometimes also faced with the imprisonment or even death of a loved one.
I'm not exactly sure why this happened. I wish we had our Woodward and Bernstein. I think if you follow the money, there might be a story there.
The only thing I can think of is that she wanted to be the #1 prosecutor of fraud in the United States.
As far as I'm concerned, it was politically motivated. It couldn't have been something that was done for the people of New Mexico, because the people of New Mexico were taken out of the equation and some people from Arizona were brought into it.
We're not looking at this as it wasn't just a loss of a job, it was a loss of a community. We lost cherished and valued members. Some of these children have committed suicide. I lost a very dear friend of mine who experienced such injustices due to a heroin overdose when she was turned away from a local homeless shelter in Albuquerque. If we don't have available supports for these individuals to go, they do not stand a chance in this lifetime. There will be no hope for them unless you reinstill the hope that we had already established as a community.
A lot of people in northern New Mexico voted for the governor when she ran because she was a Hispanic woman who seem to care about their concerns, their needs, their problems. They're the ones who now are going without services. They're the ones whose kids can't get in to see a doctor, can't get in to see the counselor that was working with them. They're the ones whose relatives are going without the alcohol or drug treatment that's so badly needed.
This year's state budget contains a $50 million increase for behavioral health, much of it from a federal match. That will mean more money, but fewer lives will be helped, because the lion's share will go to big corporate managed care companies. We need to get more resources onto ground zero, where there's a crucial need for outreach, case management, day programs, peer counseling, and drop-in centers, because that is where the people are. Grassroots and community-based programs are what the old system was all about, and they actually saved money. The choice is ours.